round two of our regional report outs as part of the state's response to the COVID-19 pandemic. This is the KC Metro region for December 22nd. This week we'll be doing these calls for every region the same time. This call will always be at 1 p.m. on Tuesdays, and grateful to have our guests here. I'll make sure some of the feedback we got on our email was to make sure we're introducing ourselves so people know who we are when we go. And if you want to sign up for these weekly emails, go to covid.ks.gov/report-outs. That's covid.ks.gov/report-outs. You can also contact us with questions, ksregionalreport@gmail.com, ksregionalreport@gmail.com, if you have something we want to discuss on the next call. So on this one, we're going to change up the format. We'll see how it works. I'm going to run through the dashboard for the region, and then we'll pass it to public health and the hospitals to give their commentary and color. We also have on with us Dr. Watson from Cheyenne Mountain Software. They are the inventors of the mission control software, which will help us understand what's going on from a transfer situation. I want everybody to understand that's kind of our focus this week on these calls. But let me go here and share my screen. And let's see here. Can you guys see the thing up? Kenny, can you tell me?
Yes.
Okay.
Yeah.
All right. So this is the week. This is this previous week. Almost all the hospitals reporting there. One of the things we look at from the hospital situation is the critical staffing shortages. So the percent of hospitals anticipating shortages this week, 78%. That's pretty high, and higher than the state average. And as we've talked about, constraints in hospitals usually are around space, stuff, or staff. And this is the staff portion. Oh, am I still on the right screen? You guys are you seeing my desktop, or are you seeing the?
We're seeing the report.
Okay, good. And then something changed on my computer there. I apologize. So we'll come back to that. We'd love to hear more about that. You can see the numbers of how the patients thread. We come down here. Another real important one is the percent of adult staffed ICU beds available. 25% available right now in the KC Metro. And these are numbers that move around. This is yesterday's number. It will have changed today. But this is how we can get a snapshot in time. And you're seeing 30 reported COVID deaths this week. And we do have 68 on ventilators with 218 available. To see what's going on here in the region, you can see how it's come, and it seems to have plateaued for right now, which I think everybody is grateful for. And I know we'll hear more about that. But this last 3 weeks, it's been 4,000 and 4,400 and back to 4149. And so we'll be watching that closely to see if there's a Christmas bump. And then here on the second page, just a little more color to what's going on in the three counties on the Kansas side of the KC Metro area, and on total COVID cases as a percent of population, and then the beds, how many are COVID versus non-COVID numbers there. So this dashboard is sent out with the call, but wanted to make sure that we ran through that really quickly to kind of get a high level set of what we're looking for. So now let me turn off the screen sharing. Sorry, this is first time for old dog learning this trick. Okay, I think we're back on the main screen. Now let me kick it over to my friend, make sure I say it. I took the note last week. Stephen Mayhew. Did I get it right? There we go.
Got it. Yep.
Go ahead and introduce yourself, and just if you can give us your color as well.
Sure. So my name is Steve Mayhew. I am a preparedness program manager with the Johnson County Department of Health and Environment. I am also the regional preparedness coordinator for the Kansas City Metro, Kansas counties. And so my update today is going to be a little bit of background on our context in the public health side of things. I'll start kind of by just sort of piggybacking on what John was talking about with the, he mentioned the Christmas bump. And last week I talked a little bit about the Thanksgiving bump and whether or not we could expect to see that. And a couple of notes that I wanted to share in regards to that. One thing we did notice is that the Thanksgiving bump was a little bit later than we might have expected. And a lot of that is because some of the labs were closed for the holidays. And so when the labs aren't open, they're not processing results. And so those get delayed a couple days. And you can see how that reporting will slow down a little bit. The other thing I'll mention is that they're cumulative. And so you've got one person at a Thanksgiving dinner who is with family and friends. And as those people go out into the community and potentially expose other people, the true effect of the Thanksgiving or any holiday bump, you really see that over time. And so just something to point out that we're not looking for one little spike that we'll see after Thanksgiving, but we're looking at that trend overall. Overall, throughout the counties in the KC metro area, numbers are still quite high. Positivity rates are still high. The numbers are still high. I know John said they're sort of plateauing around 4,000, and we hope that we certainly don't see a rise, but that's something that still remains a very substantial concern that we have, is that those numbers are going to continue to rise. One bit of good news that I want to share, and this is something that's really exciting for all of us, I think not only in the public health field, but everywhere, is health departments in Johnson, Wyandotte, and Leavenworth counties received their first shipment of vaccine yesterday. And so starting next week, the counties will be vaccinating per KDHE guidelines, public health personnel, and emergency medical services. And so really excited to get that started. The vaccine obviously isn't going to change things overnight, but it really represents that first step towards, working towards the end of letting COVID dictate how much we do and the rules we have to follow. And so the vaccine really is that tool that we can use to start fighting back. And so there was a lot of excitement around here yesterday, and I know with other departments as well. And so really looking forward to getting that started.
And Steve, let me just add, so the timeline on the vaccine is you get your first booster shot, and it's 3 weeks later, you get the follow-up shot, and then it's 2 weeks after that you're considered immune or fully vaccinated. So it's a 5-week from the first shot. Is that right?
So for the Pfizer vaccine, you get your 2 doses 21 days apart. For Moderna, which is what the health department's got, those 2 shots are 28 days apart. And so you're looking at 4 weeks there. And then you're right, it does take the body some time to build up that immunity. You do start to develop some after the first dose. You develop more after the second. And then, like you said, give it a little bit of time for your body to build up that immune response to get that full effect of the vaccine.
That's great. And just so the audience can understand too, on this call, we won't be focusing any more on vaccines beyond this, but on future calls, you'll be hearing more about the vaccine and how it's going to roll out in your region. That's great. And then I'm also going to point out the testing website, gogettested.com/Kansas. It's a good way to find where the testing areas are in your part of Kansas also. gogettested.com/Kansas. Anything else you'd want to add, Steve? That's a good report out.
Nope, I think that's about it for us.
All right. Thank you very much. I'm going to pass it over to Kenny Wilk. Kenny, can you introduce yourself to everybody?
Yeah, I'm Kenny Wilk, and I'm Vice President of Government and Community Affairs at the University of Kansas Health System. And today, get my hat on for our Kansas City operations, and I'm going to go ahead and let Bryant introduce himself. And he'll speak more to the metropolitan area, which is both the Kansas and Missouri side, and then I'll come back and just add a little bit in regard to the University of Kansas Health System. So, Bryant.
Great, thanks, Kenny. Bryant McNally with the Kansas City Metropolitan Healthcare Council, which is the grouping of the 45, 50 hospitals in the broader metropolitan region. So one of the things that I wanted to share is while we've seen numbers plateau more or less for most people or most hospitals with their COVID case counts, what was shared with me yesterday during a CEO level call with the members of the council was that they're seeing much higher levels of acuity, that the people in the ICUs are sicker, the people, even their regular COVID patients on the floors are sicker, that the strain on the system is as great as it has been, even though the numbers may be down a little bit. And that's one of those things that I think as you begin to see the high volumes that we've seen across the metro area, that becomes the case. You try and have more and more of those cases that can, do self-care at home, have lower levels of care, needed to maintain those outside of the hospital, which then continues to drive up the acuity that you see within the hospital walls. So that's probably the key takeaway that was really gleaned from that. Obviously, when we look at a lot of these metrics, it's crystal clear that the world has changed since the beginning of the COVID pandemic, when everything was concerns around ventilators. That's no longer really, an issue. As you look at the dashboards, there's plenty of vent capacity there, but there's, the logistics of managing all of the different high flow oxygenation methods that are in place with the patients in place of ventilation. But as was mentioned at the get-go, really staffing is one of those key barriers. And, there's a little bit of hope and a little bit of light as we begin to see a little bit more vaccination take place, that more and more of these staff will be able to return to the workplace, not be exempted due to COVID exposure and the like. But again, that's all going to take time, as Steve just shared. It's going to take a number of weeks before you even get the immune response, let alone getting a large enough grouping of employees that are now protected, so that they're not out of the workforce as much. So that's really some of the high level pieces that we're seeing generally across the full metropolitan region in Kansas City. So Kenny, I'll give it back to you.
Okay, well, thank you, Bryant. And first of all, I want to take just a moment, John, and thank everybody in the Kansas City metropolitan area and other areas for everything that people are doing. We know there's a lot of efforts going on to help get more people tested, raise awareness for practicing the pillars of infection prevention. And for those of us that work in the hospital, and on behalf of all those that work in the hospital, we want to say thank you. And though the numbers are high and they continue to be a challenge, I believe it's making a difference. This week, it would be fair for us to say the University of Kansas Health System, it's eased just slightly, but ever so slightly, not enough to give anyone any real relief to say, hey, we're setting a new trend. But we continue to manage, and to say that we're managing on the edge is probably the right term. And I know we're going to talk about transfers, and I'll look forward to Dr. Watson's comments on that. I did check in on that. And last week, it was actually, again, just slightly better than it was the week before. But 2 weeks ago, it was really a challenge, and it continues to be a challenge. We're hoping that maintains some level of steadiness as we go into the holiday weekend. But I would just wrap up echoing what Bryant said. We're really, the non-COVID patients really needs to be a focal point as well. There are lots of COVID patients in hospitals all across the state of Kansas, certainly the metropolitan area. And for every COVID patient that's in the hospital, that means there's a non-COVID patient. And we know there's a backlog going on there. There have been what some people would call elective procedures delayed, and we don't like that, but most hospitals are having to exercise some of that, hoping to get back into not being able to do, or being able to provide all the services that we need to. But there's going to be a backlog there, and that's just something we need to continue to talk about. So with that, John, I'll turn it back to you.
Yeah, I appreciate that. I think one of the themes and the impact of all the calls pulled out last week is what we do individually impacts our communities. And KC Metro and Wichita would be the two hubs that have probably the most expertise and tools available as you get into the acute situations. And as those beds fill up, it really impacts the rest of Kansas. So the decisions that people make in KC Metro are impact the availability of beds, really across the state with probably the most expertise, which move us to the transfers. Just real quick, we had gotten one email from Steve W. And he had asked about contact tracing and is there still focus on that? And Steve, you may mention it. It is something that's really important. And I can tell you a personal story. My daughter just tested positive without contact tracing. We would not have known that she had it and that we needed to get her tested, and she probably would have continued the spread. But Steve, is there any update on contact tracing in the KC area?
Yeah, so with the number of cases really increasing as much as they have, case investigations, which as you call the positive cases, and you ask them when their symptoms started. And then from that conversation, you develop a list of all the people they may have had contact with. And so that's your contact tracing list, is looking for those people who may have been exposed to a known positive case. Really across the metro, and I think across the state, there's a struggle within health departments to keep up with the number of cases as they come in. And so, even if you're just a couple days behind on case investigations, you'll be a few more days behind that on the contact tracing. And so a lot of departments have moved towards notifications via email or sending letters to try to just let people know that they're positive, and then asking them to do some of that outreach to contacts they may have had, just to try to help speed up that process. So it's something that's still very important, but it's something that, there just aren't really enough resources to keep up with how fast the COVID is spreading.
Thank you very much. And it is just a part, again, what we do individually impacts our communities. I was, counseling someone this morning who just had found out they were positive and helping them think through. I mean, it's better if the individuals can proactively and without feeling shame, you did not go spread this, on purpose to tell the people they've been with, hey, you probably want to get tested and be aware that, I'm positive. Okay. Thank you very much. Stephen, it's generally a couple days before you start showing symptoms that you start shedding the virus and are contagious. Is that correct?
Yeah. So when we do our case investigations, we go back to 2 days before showing symptoms. And John, to your point, just that there's nothing to be ashamed of, there is asymptomatic spread as well. And so you may be spreading it without even knowing. And there's no fault in that. Absolutely. So doing the best you can to protect those around you is always the right move.
Thank you very much. Okay, now I want to pass it to our special guest here this week, Dr. Watson, with the Mission Control software in Cheyenne Mountain, and Jesse, his teammate, in action. They're going to walk us through what's going on with transfers and how that process works, and some of the information now they're able to pull through their dashboards as all this has become more centralized and more electronic and more 2020. We probably don't want to call anything 2020, more futuristic. Or modern. So, Dr. Watson, can you introduce yourself and then walk us through what you're seeing?
Yeah, Dr. Richard Watson, practiced in Kansas for a number of years, founded Cheyenne Mountain Software, and our job with the state is to help pull resources together, both from sending facilities to receiving facilities, and then tracking bed availability and helping with placement of patients. Jesse Thomas, program manager for this project, and is in charge of all of the data streams and all of the activities that go on with the software. But our job is mainly to come in and provide hands and feet to people trying to find beds in the state. I think this whole project grew out of a need to help communities who were really strapped for resources on a human capital basis to be able to help them find the beds they need for the patients that are sitting in their hospitals. So Jesse's going to start off just with how we look at the problem statewide. And this today is mainly to focus on just globally what kind of data is out there and what's available to different individuals if they need it. Our job is to help others understand what we're seeing, and we're happy to share whatever we have in the way of information with anyone who would have a need for it. So Jesse, show the initial dashboard we pull from is the statewide data. It's done on the Monday, Wednesday, Friday rotation. And are you able to share, Jesse?
Yeah, I need to have the sharing permission enabled, and then
I think she gave it to you, Richard, by mistake. Richard, I think you need to move it over to Jesse if you're able to.
The technology.
Yeah, that'd be fun. You go to I think the, are you able to move it over to Jesse?
Try that. Are you able to do that?
I think you go to the
There
top.
we go.
Right.
I got it.
Okay,
Thank you.
there we go. Thank you.
So this is the global dashboard. It looks like a lot of other dashboards that you see, but I think visually for us, we followed this. The blue is positive tests, the red are hospitalizations, and the deaths are in the black. And I think it agrees, of course, with everybody who's saying, yeah, we had a peak early November, and then we had a little bit more of a peak in early December, and it's kind of plateaued, I will say. I think it's always a little bit misleading to try to make too much judgment out of individual things going up and down, and we can get pretty creative about undulations in these graphs when in reality, statistically, there's no difference from one side to the other. So we're just cautious. And again, this is state data that's published. We just have reformatted. Go to the second one. So when we track beds, we don't probably do it in a way that go to yeah, and pull tier 2 out of that as well into that. So we have we track across traditional receiving facilities and then some secondary receiving facilities. We do those at different paces so that we have an understanding of where the bed situation is. We've gotten good cooperation, I think, across the board. I think there are some hesitation about sharing data as it may affect referrals and all of that, but most people understand that what we're trying to do is create a list so that when our dispatchers call and our communications people make contact trying to find beds, that we have some general idea of where to start and stop. And almost always this is the look that we see. Either we're really close to capacity or at capacity. And then a lot of it case by case means that they're very near to no capacity, but they're willing to look at individual patients to see if they fit in. University of Kansas has always been open to kind of the hospital of last resort, and that's been very helpful. But the difficulty here is amazing. And I think this is 24/7, doesn't take weekends, doesn't take holidays. And this is what Western Kansas feels as they try to locate beds for a patient. Go to the next one. We collect a lot of data from the work that we do statewide. This is a dashboard that represents where every patient comes from and where they're headed to. The upper right pane shows the percentages that are COVID positive and how that relates to transports. You can see most days we're somewhere in the neighborhood of 35 to 40% that are COVID positive or COVID suspected at any one moment in the system. And that says that the majority of patients that need to move are not COVID positive. And that's interesting. And then what about the number that need a bed? Jesse, if you just go to that place, we got about 35, 40% that need a bed. What percentage of those are COVID positive? Then it's jumping up. And now we're in the 63, 64% of the beds needed go to COVID. If we go to where, let's go non-COVID at this point, the time frame difference, if we look at just how long it takes to get a non-COVID bed, we're at running about 1 hour and 4 minutes roughly. If we go to a COVID, or we go to a COVID bed.
And are these live dashboards right now, Dr. Watson?
Yeah, this is live data as of, in the last 2 hours. We update these every 2 hours. So
we're looking at the last 30 days as this snapshot. So we can see if it's a COVID positive, that median time waiting for a crew to arrive on site jumps significantly from COVID to non-COVID. And if it's
go to the non-COVID that needs a bed.
So non-COVID that needs a bed, then it jumps to 3 hours, close on the median time before a crew arrives on site to move that patient.
And pull one out, pull Setanta just as an example of what I think we think about these as individual cases. So here's a GI bleed out of Setanta that, you're working significant amounts of time, almost 6 hours before you find a bed and get a crew on site to transport them.
And what would that be in non-COVID normal times? I mean, just to give people a frame of reference.
Yeah, I mean, we usually anticipate that it'll be less than an hour. I mean, honestly, these happen very quickly at most facilities. We do have a regional ground problem even before COVID, where it's tough to get regional ground resources if the local EMS can't take the patient. We have significant resource problems at that level. But most of these at this acuity level, when you're acuity of 12 and you're going to move that person usually by air, and this one ended up going by airplane and to University of Kansas. So, you think about where we are with resources across the board and how tough it is for any critical patient right now, anyone with a time critical diagnosis, anyone that's that's looking for a bed. It affects all the patients. It doesn't matter if it's a heart attack, a stroke, or COVID. It's a tough system. Any questions? The team here, happy to. We're offering this up. Interested to know if there are parts of the data that people would like to see. We certainly will parse it by regions, and we'll introduce region-specific data. But just to familiarize everyone with the power that's here and the ability to help these outlying hospitals, especially move patients quickly.
Yeah, and Dr. Watson and his team have agreed to be partners on this to help us. We really think the transfer situation, looking at week to week, can really start to show us where we're putting massive strain on the system. And what that means is not just if you have COVID, as he's making the point, that it could be any ailment, any acute, that as you need to move up the chain of expertise and tools available in different hospitals, time matters. A lot of times the longer it takes you to get where you need to go, you are in worse shape by the time you get there because you haven't had the tools that you need where you are. So this is a big story for Kansas, and it all rolls up. And this is the KC metro region, but it impacts their ability to move around too. And as the rest of the state has to fill up beds because they have needs, it all matters, and that's why.
Yeah, I think the story with KC Metro is that everyone really looks at the volume of patients that can be accepted in the KC Metro region, and really are dependent on that for moving patients inbound. I mean, it's so important, and the burden. I mean, when we have somebody sitting out 4, 5, 6 hours, where the management of that patient may be way over the heads of the providers in those local areas. It's so important to give them the tools they need to not only be able to finish the treatment, get them to definitive treatment, but also to provide them with consultation help to help them manage the patient in place while they're waiting for the next step. So we're working at all levels of that. We're coming alongside wherever we can throw in a hand, pick up a shovel. That's what we're doing.
We sure appreciate it, Dr. Watson. Jesse, thank you guys for that presentation. Before I wrap it up, Kenny, Brian, Steve, anything you guys want to add?
Oh, I'm good.
Okay. So this is good information. Brian, did you something you want to say?
Nope, nothing here.
Okay. You look just like your picture. Hey, so again, you can get these reports if you go to covid.ks.gov/report-outs at the dashboard. And this video will come to your email box so you can watch it when you're able. If you have questions you want us to address or comments, ksregionalreport@gmail.com. You can find out where to get tested at gogettested.com/Kansas. The vaccine's coming out this week. Much needed hope for the team members out there. I heard it called an injection of hope, quite literally. People have been working long hours in the health systems and in public health, and to have something that feels like they're more on the offensive is life-giving. And so thank you. As we look at this year, I wish you guys all happy holidays. Let me end on our bright spot. Again, bright spots are just remind us of the goodness that's out there, catching people doing stuff right. And as far as in regards to response to the pandemic, this is in Wyandotte County. Students who want to reduce food insecurity and help with PPE are creating baskets complete with foodstuffs and gift cards, as well as branded masks, hand sanitizer, and disinfectant wipes, and giving that out. We do know that there's a lot of pressure on food pantries, and there's a lot of food insecurity out there, and a lot of mental health generally this time of year, but especially with this. So if you have the ability to reach out, show some kindness, a touch, a phone call, thinking about people on your street, that always helps, and we can all do our part. So thanks to everybody who's doing all their work. We'll be back the same time next week, 1:00 for the KC Metro region. And we wish you all very happy holidays. See you next week. Thank you, guys.
Thank you.